Okay, for any possible, for the knee as well, what we did before, it can actually, you can actually again do this and hold and follow and see, and usually the hand, the system will do itself. It can go from the hip, it can go from the knee, or just move a little bit, but very tiny amount. Now with this, again, this type of unwinding, fascial unwinding, we are allowing ourselves to let the system drive. So what you do, you again, if you get too involved, you just stay up, centered, connected, and that's it. That's what you do. Now, this is for the knee. For the ankle, I call it foot. If there is any injury there, then what you do again, you just hold the foot up, and you just hold above both sides. You can hold anywhere, and just allow again and connect to yourself, center, and allow the foot to just unwind. And you can put your hand anywhere and allow. So again, before you start any unwinding, just see, or with the intention of unwinding, and see if the system wants to do something about it. Just move to see if there is any restriction up and down, and then if there is any restriction, we can ask the system if they what that restriction is, if it's physical, emotional, or otherwise, and trauma to the foot, physical trauma, any other trauma stored there, and with any unwinding. It's not just the foot, but quite often, even as children, we just jump and hurt the foot a bit, and there is a thought of the actual muscle retrains that that shock, that trauma, that pain, depending how also the child or the baby or the adults was in what state they were and how they reacted to that, and so there can be some emotional that they need to release, and they will let go. And again, for today's sake, we're not just doing any deeper work, so but with the client, usually that's what you do. You allow the system again to drive and decide, and you just follow. And this is one of the best way since the beginning that I've learned this, that I found amazing. And remember that any limb will be really light. So quite often the person thinks, for example, that I'm actually moving the arm or the head, and when I say no, actually you are moving it, it's quite hard for them, because sometimes actually when I have my hand on them, I don't even hold it. I don't, I just follow. It's there for support, but it's not, it's not doing anything. So, and they can realize that as well. So for babies, that's one of the best, the fascial unwinding, because they have still that inner wisdom. The body has got that inner wisdom, and so if you allow them to decide what is that the body needs to do, they will start moving in one direction, then the other. They can go up and down, and they can literally turn around for their unwinding, depending if there is a C-section, fast delivery, anything that caused a shock, and even nothing, just in the womb. They really so sensitive that they picked up every single stress hormone from the mother, or they heard screaming. There has been, the mother work had a lot of stress. So all that can be picked up by the baby. And so and even with the natural birth, you can actually see some shock release and some unwinding there. And when there is a mild torticollis, also that is amazing, because it's the system itself that decide, this is what I want to do. I want to turn this way, I want to turn that way, I want to turn this way. And it's amazing for reflux, for colics, if they are due to either shock, or shock hasn't been released, or too much tightness. I've seen it all the time, and therefore they want to let go. So at the end of each session, especially if you finish with the head, you do stay at the feet and ground. So, and remember that even though sometimes you are at the feet to unwind, the entire body is going to unwind, and that's what you need to realize as well.